Good morning, and I would like to welcome Michael Nula. And this interview is for Talk with Doc series, and I have a distinctive pleasure to talk to the doctor of physical therapy and the founder of Elite Physical Therapy multiple offices in the lovely Providence and Rhode Island, where I also practice. And Michael, welcome.
Thank you, doctor. Thank you for having me.
Of course, of course. So I noticed that you are not only very active professionally, but you also outreach to in social media. So I think that we may have a vivid conversation about physical therapy, and I have a big interest in learning and education about what you guys do and how you can help our patients. And I'd like to make it very targeted today. Today we're going to talk about a hand. But first question I have to you, it's been such a challenging time and my patients have some hesitations in going back to physical therapy. So could you please tell me a few sentences? Are you guys up and running? And should patients take any special precautions? What precautions you taking when you're seeing patients right now?
Yes, yeah. So we are open and we're offering in-office as well as telehealth appointments. And now we've also started doing in-home for people with Medicare Part B.
Right.
So we're doing the outpatient physical therapy in people's homes for those that maybe have transportation challenges, or maybe they just are still wanting to stay in their home for a variety of reasons.
Sure. So that's great to hear that you're offering in-home services, but also that you're utilizing telehealth. That's really great to hear because I think it's a very viable options. I've seen some very educational videos on multiple physical therapies, especially, I think it's sprouted right now around the pandemic. A lot of people are doing these short segments. So I'm glad that this is offered in your office, and I hope that it will continue after the pandemic. What's your feeling about that?
I do too. I think we're seeing that we're trying to open up pathways for people to connect with their providers, no matter what the specialty. We're trying to open up access. We're all well aware that the best way to manage one's health is to be proactive, and if something comes up, to get early and immediate intervention. So something like telehealth, people can access their provider right from the comfort of their home. So I think big picture, this is something that we can look forward to seeing in healthcare stick around, and it excites me. I think a lot of times when you think of barriers to access, sometimes it's time and transportation. So if we can remove that by people being able to access us from home, or if they're at work during their lunch break, whether they want to access their physician or their physical therapist, I'm interested in seeing what that does, long-term for health and managing society's well-being.
And it's very interesting that you mentioned it, because I think that telehealth may by surprise become one of this equalizer where I'm thinking about this particular few of my patients who were unable, due to just what you said, family relations, whether they were mom of 3 kids and they couldn't come to my office. Or one lady that I'm thinking about, she had multiple buses to take to my office. And now if you have cell phone, you can reach out. And it's not always perfect because the exam is still very important. But if it's a chronic patient that I feel comfortable, I think it may really narrow the gap for the social issues for many of our patients. And I practice in the somewhat underserved area of Rhode Island. So I think this is a great tool going forward, I think.
I agree. And I think now more than ever too, it's important to provide society with stable resources, for stable information. It's too easy to go on the internet now and find information. And a lot of times our patients get misdirected going into blogs and social media, and they get misinformed. So, if it's easier access their providers that they have a relationship with, they can settle their mind early, which I know psychologically and emotionally that helps with managing health too. So on a variety of levels, I think that it's a no-brainer to keep telehealth around for a while.
Great.
But I'm also passionate about the in-person visit too.
Yes.
So while I think telehealth is good, it's a nice ancillary adjunct service. There are times where we can't deny that a patient needs to come in the office
Absolutely.
and meet with their provider, and And so we've taken great steps to make sure that we're putting patient safety as a
Yes,
priority. So, I mean, just to speak
absolutely.
on behalf of our group, we heightened our cleaning procedures.
Mhm.
We have screening procedures when patients arrive and thermometer checks. Everyone's to wear a mask. Everyone's washing hands or sanitizing when they come in to the office and when they leave. Anything that's been touched by a patient is wiped and sanitized immediately. So we've really taken a lot of extra steps to ensure one's safety here, and patients are benefiting. You know, we have private treatment rooms, and we've also gotten very creative with positioning patients when we do certain hands-on treatment techniques so that their face is turned away,
Mhm.
even though we're both wearing masks. But you know,
Yes.
it's also helping patients feel safe and showing them that we're taking this seriously and we're putting their safety as a priority. And they're noticing, you know, and I think that level of comfort is important, especially during this time.
So that's excellent to hear because I started to be more liberal about referring back to physical therapy. Uh, and I have stories, a few of my patients that had a surgery just kind of before pandemic. And I remember what struck me is one patient who told me that her recovery is so delayed because we didn't know how to fully deploy the physical therapy help. So I'm glad that, we back in action because we have to. And so talking about, reliable resources, uh, this is why, I'm doing it with the expert. And, I have a question specifically to you about the hand condition.
Yeah.
It's called vein tenosynovitis, and it's the degenerative condition of the first compartment extensor tendons that run along the thumb and attaches going toward the forearm, and there are these big, small, but major tendons of the thumb. So when patients come to my office, I diagnose, we differentiate with our disorders, make sure that it's not a nerve condition or osteoarthritis at the base of the thumb, which is also very common, and I treat a lot of that. But also, something that's called intersection syndrome, which is a little bit lower in the forearm to diagnose. Probably some other also conditions like inflammation, maybe related to gout, especially if the joint is swollen or warm. And I'm thinking, that I don't necessarily want to inject patients. A lot of patients are very, hesitant to do injection as part of a first treatment. And some of them, especially with a darker skin color, worry about discoloration that may be a problem with the superficial injections because how potent steroids are. So I wanted to ask you about rehabilitation of this de Quervain condition or tenosynovitis, which is a condition we all use hands a lot. It's usually been attributed to young moms, but we know that it bridges much more than that. Anybody can have this condition. So how
Yeah.
would you help the patient? What would you do?
Yeah, well, I mean, it first starts with a thorough history to figure out when, you know, the onset and how it came about. I mean, oftentimes it's a repetitive stress
Mhm.
condition. So, you know, we'll learn that there's some sort of repetitive motions going on at the wrist and hand. And then we take it a step further and we usually learn that there's poor ergonomics or poor posture, right?
Mhm.
So, you know, the introduction of the device, the increased use time of laptops, it's putting people at a mechanical disadvantage. So if they're kind of slouched over and their wrists are flexed, and there's a lot of, you know, repetitive stress with fingers and thumb, and this kind of what we call radial deviation, where you're moving your wrist inward. Maybe there's a mouse to the side if you're also with a desktop. It's just a perfect storm
Right.
to get that tendinous junction there in the sheath to get irritated and inflamed locally and create some discomfort for people. And then what happens is if it's allowed to hang around for a while, grip strength becomes rather weak.
Mm-hmm.
Sometimes there's sort of this referred or radiating pain throughout the forearm,
Yeah.
sometimes into the hand, and then it becomes very uncomfortable for people.
So that's a very interesting point that you brought up. So the history became so relevant in the telehealth because there's so much information that patient can provide you that you differentiate and narrow it down. But what I liked also is that you referred to what's the sign of time, that we all spend so much more time on computers typing. So the first thing is to alert patients that maybe there is something that they do incorrectly at their home, which they will not if they don't pay attention to it or adjust, they're going to have this problem chronically.
Right. Yeah. So in physical therapy, we like to take a deep dive into the why, right? Because we can go straight into treatment and start addressing symptoms and the condition at large, but there was a cause.
Mm-hmm.
So let's find out what caused it. And, if we're in a telehealth environment, we can say, hey, show me your workstation, show me where you're spending a lot of
Yes.
time.
Oh,
If
yeah.
they're coming into the office, we say, just take some pictures or have someone take a picture of you at your workstation or a video and bring it in so we can just take a look at things and make some recommendations. So something called ergonomics, where we want to improve their posture, improve their workstation. And a lot of times it doesn't cost them anything. They don't need to go and buy these expensive gadgets, but rather it's a better positioning of their existing workstation, maybe their chair and adjusting height, their desktop or tabletop. So we make a few tweaks, and then we go a step further and address some of the other symptoms and so forth. And one component too is diet. I mean, what are they eating? Are they eating a lot of foods with salts, or are they retaining a lot of water, right? And so things of that nature. Are they including anti-inflammatory foods? Are they getting their fruits during the day? And
Yeah.
those little things go a long way. So we try to look at like the whole comprehensive picture.
Yeah. So, and a lot of women come to me with this disorder, and they say that it dramatically limits them of doing things like yoga or Pilates. So they really want that for me to fix it very quickly. But I tell them, and again, there's this hesitation for injections. The one of the first thing is to apply the thumb brace.
Yep.
And so I have a question to you. Do you usually recommend people to just get it somewhere and over the counter, or do you provide it in your office? Do you mold it in the office? How do you go about this bracing procedure?
Yeah. So, to mobilize it, I mean, all the pharmacies are carrying reliable products now. So we'll usually advise them to go to the pharmacy locally, or they can go onto Amazon, and you can usually find yourself a good splint, and then they bring it in and we'll verify that it's good quality. And then you immobilize for a period of time, and then you address the inflammatory symptoms. And then you want to empower people with things that they can do themselves, so that they're not just relying on what's the physical therapist going to do. So that, in conjunction with applying some anti-inflammatory modalities locally to the tendon to help reduce that inflammation. And then sometimes too, there's some tissue density along the forearm. So as you start kind of poking around, on the extensor mass on top of the forearm, or on the front of the forearm, there's some tissue density. So sometimes we need to get in there manually and loosen up that tissue. Because if there's a lot of resistance and a lack of pliability throughout that forearm into the wrist and the thumb, that sort of painful cycle is just going to continue, even though they come out of the splint and we address the inflammation. So we want to get some of those secondary and tertiary impairments too.
So you mentioned manual therapy, which is, again, we're going back, but there is definitely need for this human contact and therapy contact. And, there's just the healing in human touch. And I think you recognize it very vividly. And I went to the physical therapy myself. And I remember, one of the things that I really liked is the continuity of care with the same therapist. And for me, it was very valuable, because one of the things is I didn't have to talk to to the different person the same story. But a few times, it ended up being two people, so I repeated the story the second time. And I liked that aspect also, because that provided a little bit of a difference of approaches, and there was a male touch and a human touch, and I appreciated both of that.
That's great. Yeah, in a group like ours, we provide one-to-one physical therapy. You start and finish with the same therapist, so that one can have that continuity, which is very important. And it strengthens the working relationship. I mean, at the end of the day, I know our group is very passionate about connecting with people. We want it to be more than just another medical office experience. We want to have a relationship with our patients. We want them to feel comfortable. We want them to learn something too, that they can do to take care of themselves, not only during this condition, this episode, but how to prevent the likelihood of it reoccurring in the future, or just empower their mind on just the idea that, wow, if I just do a few things and incorporate it into my lifestyle, I can dramatically improve my physical health. And then that excites people so much that they become ambassadors of good health. So they start telling their family and their friends and their coworkers. And
Yes.
that's the stuff that energizes us, is sort of that pay forward ripple effect, that if everybody's just sort of helping each other on a
I
larger
love it.
scale,
I love it. And I am a big proponent, and I'm trying to advocate for a number of years right now for the incorporation and integrative healthcare model, which is particularly important in musculoskeletal disorders. And I really love the cooperation and the part that you guys help with rehabilitation, especially of rheumatological disorders, which, as you know, it's chronic. There's nothing, a little injury here or there, or maybe after knee replacement. These relations are going to be chronic, and sometimes it starts with one organ. And as you said, this relation is important because I send them for something else in the future.
Yeah. Yeah, and then that collaborative care model, we want everybody, all the specialties talking together, feeling confidence, getting their communication and whatever they need to manage their patients well.
Yes.
And then have the confidence, like, what, I have a question of physical therapy, let me call and know that I just have to speak with one provider that takes care of this patient of mine.
Yes.
And so now there's more point to point, and then that's more confidence for the patient too. To feel comfortable knowing, what, I'm surrounded by, very capable and able providers that are invested in my health, and they're all talking and collaborating. And
yeah,
when that confidence is high, I think what you get is people being more responsible and proactive with their health.
absolutely,
rather than waiting until it's so bad to drag themselves in to see their provider.
That's true. And American College of Rheumatology endorses multiple physical therapies for various rheumatic conditions. And the examples that I can provide right now is osteoarthritis, whether it's physical therapy of hands, knees, but also ankylosing spondylitis. I tell my patients that if you think that I can only help you with medicines, and you are not going to work and invest your own time with physical therapy, physical activity, I can tell you that we're not going to gain much ground because there's so much in your hands. So I really like this endorsement by major societies like that. I think it is more fruitful and definitely more beneficial for patients.
I agree. Yeah, I absolutely agree.
So Michael, for the last minute or so of our meeting here, our virtual meeting, I'm going to ask you, so we all want to prevent decurvain tenosynovitis to our hands. How would you, what is the simple stretch or exercise that you can show to everybody who watches that they can strengthen their hand or hand joints or muscles to prevent injuries?
You got it. Yeah. Well, first, since physical therapists, we kind of consider ourselves movement experts and postural experts. I'd say first step is just make sure your workstation is correct. You're sitting upright in a chair. Everything's 90 degrees from the elbow, and they're close to the body when we're working at our workstation. So that's like the first and foremost. And whether you're a younger patient, like you mentioned earlier, with the video games, it's the same thing. Getting upright. And having the wrist in a neutral position. So if it's flexed and you're doing things like this on the keyboard, or if you're gaming and or texting, holding your device, get your wrists in neutral position.
Okay.
That's super important. And bring the device to your face rather than your face to the device. And that becomes very important too. And then the laptop, so often it's in the lap and we're cradled forward and hunched over. Put a pillow on the lap and get yourself upright if you're going to be on the laptop. Okay. So that's the first start. But in terms of stretching, just getting your elbow extended, arm extended out, and grabbing kind of just below the wrist joint and pulling down. And holding for a minimum 30 seconds. You should feel that stretch on the top of the forearm, even down across the wrist. The stretch should be comfortable and tolerable. It doesn't get looser faster if we pull on it harder. So I always tell patients, just find what's comfortable and tolerable and then hold it for minimum 30 seconds. And then go ahead and flip it upward. And then now give it a gentle stretch up this way so that you feel the stretch on the bottom of the forearm. And that one's 30 seconds as well. And those, I mean, to prioritize, I think are really important. In terms of like when to stretch, it's good to stretch muscles that are warm rather than cold. So, I mean, to your point, what are some strengthening things? I mean, you could just as easily open and close your hands. If you have a stress ball, you could squeeze the stress ball. If you want to roll a ball of socks, you could squeeze some socks, but something just to get the blood moving. And again, I'm doing it with neutral wrists, and I would do it at the sides of my body. 30 grip squeezes just to get blood moving. Then I'd go into like my stretching.
Okay, got it.
So that'd be like the right sequence to prevent any sort of deeper veins or any tendinopathies around the wrist or the elbow.
So that's very useful. I am definitely going to incorporate it in my busy day. And again, Michael, thank you so much for agreeing to do this interview. And I am looking forward, hopefully, to talk more about in the future, maybe some additional disorder. Maybe you can choose something that you can educate me about.
Sure, happy to. Yeah, thank you.
Okay, thank you.